Hi everyone, this is Dr. Hall, and I just wanted to start us off with a little introductory lecture, just kind of giving you some initial perspectives about public health before we kind of launch into the textbook on some of the more kind of official curriculum for the course. So welcome. I'm super excited that you're taking this course and exploring these things with me. Please reach out if you have questions or concerns at any point as we go along in the course. And let's get started. So the first thing I want to talk about is what is health, right? So if we're going to be talking about community and public health, we want to say, well, what do we mean when we're talking about health? And so, of course, if you do what most people do and go to Google and ask Google, what is health, or ask Siri, what is health, you're likely to get the definition that we see below. So the state of being free from illness or injury. So that definition of health is kind of a classical one. It's been around for a long time, and it's really a negative, right? It's not a state, it's being without disease. So some people said, well, gosh, that's really, just defining something as the absence of something else is not really ideal. So if you look a little bit further, you'll find some other definitions, right? So the World Health Organization describes health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. So infirmity is like disability or having pain or decreased function. So that's a little bit more comprehensive, a little bit more positive definition when we think about what health is. And we tend to default think of health in two general categories. So physical health is one that has gotten a lot of attention. It's one that's pretty obvious. It's one that often causes fatalities. If you don't have good physical health, that can lead to your death. So there's been a lot of attention paid over the years, and certainly in the medical world, of attention to people's physical health, as well as the things that seem to be important in maintaining one's physical health, right? So, exercise regularly, get enough sleep, eat healthfully, go to the doctor, get your preventative care, all those types of things. In recent decades, we've also come to realize the importance of not just your physical health, but your mental health. So also your emotional well-being is really a huge part of your overall wellness. And we've got a lot of renewed attention to how do we support and promote people's mental and emotional health, not just their physical health. I want to introduce you to a kind of even more comprehensive way of describing health, which is the 8 or 9, according to this one, dimensions of wellness. So this is a different way of looking at, well, what makes a healthy, thriving human being, right? So we see some of the things that we've already talked about. So we see physical and emotional health on here. But we also see some other things, and I quibble a little bit with some of these, but I'll just kind of take you through them quickly. So spiritual health, so that's your sense of meaning in the world, which may or may not include participation in a particular organized religion or philosophical tradition, but that sense of connectedness or meaning, or that there's something greater than, can be really important and has been shown to make a difference in people's overall health and wellness, absolutely, and improving people's quality of life. I'm kind of going backwards. I'm going counterclockwise here. So social health is about our relationships. So humans are social beings, and having relationships, healthy relationships, loving relationships, and a sense of connectedness to others is hugely important in how we experience the world. So those are kind of all go together. I'm going to skip over to the other side and talk a little bit about intellectual and environmental. So intellectual health refers to the fact that we are curious beings by nature, and we need to have stimulating things to think about. We need to be learning new skills. We need to be using our brains in order to feel really good about ourselves. We need to be accomplishing something. We need to be puzzling things out, learning new things. Environmental health refers to what we often think of when we talk about the environment in terms of thinking about climate change or air pollution or the safety of our water, the quality of our farmlands, all those types of things. But it also talks about your environment on a more intimate level. So what's the physical space around you right now like? Is it a place that's warm and comfortable and conducive to health? Is it cold and drafty? Is it cluttered with lots of stuff that's distracting, right? Or have you done the Marie Kondo thing? Is it really serene and peaceful? So our environment is kind of the big E environment, but also all of the local environments that we inhabit in terms of where we live, where we work, the places where we spend our time. So I'm skipping around a lot because I'm going to talk about both occupational and financial health together. So it's interesting that in our current society, financial health is really important to all of the other things. So if you don't have enough money in our society, you cannot furnish your basic needs for food, shelter, clothing, all those types of things. Not all societies are organized that way, but ours is. So your financial health and your ability to meet your needs as they arise and operate in the world and continue to do the things you need to do or that you want to do is pretty important in our society. And then occupational health is related to that, but different. So in this sense of the word, in terms of wellness, do you have a job? So it refers to, do you have a job that is fulfilling, that is interesting, that feels meaningful to you, and that is not overwhelming and is not too stressful and does not completely drain you? So that's kind of occupational health. And I quibble with that one a little bit because it's been kind of a recent trend in our society that we view your job as something that should give meaning and satisfaction to your life. But the reality is that one's occupation or career or job may not necessarily be hugely meaningful in and of itself. If you get meaning from other parts of your life, maybe working at a factory is just fine, I quibble with it a little bit. But we tend to think, oh, you should have a job that you love and is very intrinsically fulfilling. And I don't know. But anyway, so 8 dimensions of wellness. There's a link on the side there. So a lot of college campuses have some really great websites about wellness and helping you understand all these different dimensions. So check that out if you get a chance. This is another description of those different aspects of wellness. This one has 7, but again, we see emotional, intellectual, physical, social, environmental, financial, and spiritual. So you can see they leave off the occupational. That's kind of combined into the other ones. Here's yet another graphic. There's some really pretty things out there as you kind of think about all these different aspects of your life. And so I challenge you to think about, what are you doing in all these different avenues of your life to help maintain and foster and promote your health and wellness in each of these different aspects, because they're all actually pretty important. Okay. We're going to shift gears now, and we're going to talk a little bit about determinants of health, which is related, obviously. So what are the things that determine how healthy you are? Now, for most of medicine and public health, we've been focused primarily on your physical health and now your mental and emotional health. So that's going to be those are going to be the big drivers, or the big factors that we're looking at. But what are the things that determine whether you're likely to be a healthy person or an unhealthy person? Or at the societal level, what are the things that tend to make for a healthy, thriving population versus a sick or debilitated population or groups of people? So most of the time when we ask people what determines how healthy people are, we get a lot of responses, and I'll be interested to read yours from the quiz about behaviors, right? So are you eating good foods? Are you exercising regularly? Are you moderating your intake of alcohol or other recreational substances? Are you not smoking? Are you meditating regularly? Are you getting enough sleep every night? So we tend in our society to place a lot of emphasis on these personal behaviors, these choices that we all make either consciously or subconsciously about what types of things we're going to do to either promote or perhaps jeopardize our health. And so oftentimes people think of those as the most powerful influences that you have over your health. But I'm going to show you today that's usually not quite the case. The other thing that people talk about is your genetics or your biology. And certainly in some cases, such as if you inherit a particular genetic disease, this can have an enormous impact on your overall health. And even for things that aren't kind of as strictly inherited, like cystic fibrosis or hemophilia, or things where it's a specific genetic mutation, we see that things like heart disease tend to run in families, or diabetes tends to run in families. And while that is true, I'm also going to tell you that that overall is a relatively small piece of all the factors that go into determining your health. It's an important one, but it's a small one. The other thing people often talk about is medical care. So your access to medical care and your ability to get good quality medical care. So everything from preventive care, like being able to get your regular checkups, your vaccines, your pap smears, your colonoscopy, your even getting your regular dental visits for your tooth cleanings and any cavities taken care of at the dentist's office, and then getting care when you need it for things that arise, like being able to get your appendix out if you get appendicitis, or being able to get emergency care for a heart attack, or orthopedic care for a broken leg when you fell out of a tree. So your access to medical care, of course, is going to be an important piece. And then finally, the thing that people often don't acknowledge overtly is the social and societal characteristics. And so I'm going to actually show you that those things all together probably have the biggest impact on your overall health. So bear with me here. Let's go through it. So when researchers look at what are the things that are most powerful in determining someone's health and well-being, this is what we find, right? So only about 5% of your overall determinants of health are your particular genetic code and your biology, right? Just how you're born, how your body is built and put together, and what are the things that you're vulnerable to, especially based on your own personal biology. A decent chunk is your health behaviors, so whether you smoke or not, whether you exercise regularly or not, all those things, of course, are important. And then about equally important is your access to good, quality, accessible medical care to both prevent diseases and manage them when they arise. But what you can see is that more than half of what determines the health of a population or a community of people is going to be actually those social or societal characteristics. So the total ecology within which a person exists. And let me show you why. When we think about what humans need, so when we think about what you learned in elementary school, like what do we need to survive, right? We need food, water, air, shelter, and clothing. And not only do we need those things, right? We need those things to survive. But then if we're going to be healthy, we actually, when it comes to food, we need enough food so that we're not starving. But we don't want too much food because then we can get into trouble with obesity and all the diseases that that predisposes us to. We also need food that gives us the full range of vitamins and macronutrients and minerals and all those things we need, right? We need enough protein, we need enough iron, we need enough calcium, we need enough vitamin C. All of those things are really important for health. So it all falls under food. We also need food that is free from contaminants, right? So that it isn't contaminated with pesticides. We also need food that hasn't been contaminated with bacteria that could make us sick or cause an acute illness. So we have lots of factors that go into the food that we eat. Now in the United States, most, but not all of us, have more than enough access to sufficient quantity of food, although there are many food insecure households, as we'll talk about. Not all of us get all the vitamins and minerals that we need, however, partly because of food choices that we might be making intentionally, but sometimes because of food choices that we're making based on economy, right? Based on financial factors. You can get a lot more calories for the dollar off the McDonald's dollar menu than you can buying organic produce at Whole Foods, right? So your ability to get nutritious food, healthy food, is going to be impacted by your financial situation, by your access to the places that sell those types of food. So you can see how those social and societal determinants actually end up being really important. Water, same thing. So you think, oh, well, everybody has access to water. Well, in this country, most people do, not everybody. But we also want to make sure that that water is healthy, that it is clean and pure, that it's not contaminated with bacteria, also that it's not contaminated with pesticides or other potentially harmful chemicals, or lead, for example, which, as you probably are aware, is a problem in some communities in our very own country. When it comes to air, so talking about lead, right? Only certain communities, right? Based on really kind of socioeconomic status, right? So certain communities are at risk for lead contamination of their water, and certain communities are not. So those social factors are really important. When it comes to air, again, is the air that you're breathing clean and free of contaminants? Well, if you live in a really low income neighborhood that's perhaps in the flyover path from a major airport, then no, it's not actually. And you're actually inhaling quite a lot of carcinogens or things that can predispose you to cancer. So you can see how all of these things are hugely important to your overall lifelong health and wellness. And when we kind of think about why these are so crucial and so important, a useful paradigm to look at is Maslow's hierarchy of needs. So Maslow was a psychologist, and he looked at what are the things that are necessary for people to really thrive in life. And he was interested in what he called self-actualization. So you being able to be the fullest, most productive, happiest, most well-adjusted, fabulous person that you possibly can be. And so he found out that there seems to be, for the first criterion that has to be met is your basic physiologic needs need to be met. So you need to have food and water and shelter, right? Just all those basic needs need to be met. Then you need, and without that, then everything else is kaput. Then you need to have safety and security, right? So you need to have a home. You need to not be worried that you're going to lose your home or that you're going to lose access to food, right? So you need to have safety and security. And then above that, love and belonging. So again, kind of talking about those social relationships, and then esteem and self-actualization. But so what you can see is many of the things that humans need to survive and certainly to thrive are these basic foundational things, and our access to those is usually determined by our social and societal circumstances, right? That has nothing to do with your own individual behaviors, your own individual biology or genetics, and certainly it's related to your access to healthcare, but that's a different thing. Okay, so the big things, which we often don't think about in a wealthy, highly industrialized nation, but which are easy to see the effects of the absence of in developing nations, right, are those kind of basic physiological needs, and that's usually determined by social and societal factors. So, ability to meet basic human needs is determined by social and societal characteristics and part of the system in which you live. So we're going to shift gears and talk a little bit about what is public health and kind of setting you up to think about the lens through which we're going to be approaching health for the next few weeks. So I like this definition. It's from the textbook. So the science and art of preventing disease, prolonging life, and promoting health. right? So I think that last one, I think, is one of the most important ones, through organized community effort. So this is things that we're doing at the community level, not at the individual level, together with different systems and different groups of people on a societal level. So that's a really important distinction between public health and healthcare or medical care, which is kind of the one-on-one taking care of that individual and what they need at that moment. Public health is we're looking at everybody and how can we make a big change for the population as a whole. When we look at the functions of public health, this is a slide from the CDC's introductory module on public health, which they have a great free online module that you can do, which is lovely. And they kind of break the core functions down into three main categories. So the first one is assessment. So as it says here, systematically collect, analyze, and make available information on healthy communities. So I like to think of this one as what's going on, right? So what's going well? What isn't going well? What type of health problems are we having? Are they increasing? Are they decreasing? What are the factors that seem to be driving those health conditions, right? And then communicating that information to community stakeholders. The second one is policy. So promote the use of a scientific knowledge base in policy and decision making. I like to think of this category as what can we do? So based on what we know about the problem, what is likely to be helpful at improving or addressing the problem? And how can we work together with other members of the community to figure out a way to approach it or to solve this problem? How can we address this problem? So I think of policy as, okay, based on what we know, what do we think would be helpful to address it, right? So what can we do? And then finally, assurance. So ensure provision of services to those in need. I like to think of it a little bit more broadly. I don't love this slide. Is it working? Okay, so we've made these recommendations, we've put them in place, we've worked together with local government or community groups or healthcare organizations, and are the things that we're doing actually helping to address the problem? So what's going on? What can we do about it based on what we know about it? And is what we've done about it actually working, right? And then we kind of go back to the drawing board and say, okay, well, if it's working, then great, how do we continue it? And if it's not working, then let's kind of figure out why and rework things. So CDC then takes those kind of three overarching things of assessment, policy and development, and assurance, which I think of as what's going on, what can we do about it, and is it working? Into these 10 different services. I'm not going to quiz you on what these 10 different things are, but I just want you to be aware of what's involved in each of those, right? So in terms of assessment, public health agencies are constantly monitoring the health of the population. So they're collecting data, all types of data, as we'll talk about later, and monitoring the health of the population to see what's going on and what's happening. They will also diagnose and investigate. So if something crops up or something seems unusual, they will say, oh my goodness, is there an outbreak of something here? What's going on? What's causing it? They will also investigate the causes of things that you wouldn't think of as necessarily like infectious disease outbreaks. So if we were seeing an increase in childhood cancers, for example, public health officials would try to figure out, are there some potential reasons why that's happening? Because if we understand what's the cause, then maybe we can help better figure out what to do about it. So then we move into that policy development, that what can we do, right? So informing your partners in the community, your other organizations, and local government and federal government, all layers, right? Let them know what's going on, let people know what's going on, and figure out, right, mobilizing those partnerships to then figure out what are going to be the best interventions, right? So that's the policy development part. And then assurance, right, is it working? So are we implementing it appropriately? That would be the enforcing laws and linking to or providing care, right? So with the COVID pandemic, right, for example, our health departments have contributed to the ability of people to be able to get tested and to get vaccinated, right? So they've kind of augmented the healthcare system's ability to do those things. Those are usually done by the healthcare system, but public health stepped in to help because there was such a need, right? So making sure that what we're doing is working so that we're doing it appropriately. They also want to make sure that we have a competent workforce, that we have people who know what they're doing and are well trained, and then evaluate the outcomes, right? So are we doing the intervention properly and is it working? So are we seeing a reduction in the problem, right? Are we seeing improved health? And then the 10th is that central thing, which is research, right? So research is important to all of these aspects in terms of how do we best and most effectively figure out what's going on, devise a way to address the problem, and then see if it's actually working. So I just want to summarize this introduction and what we've talked about here. So what is health? So we talked about how primarily we've talked about physical and mental health, and that's certainly what we have the most data on. But there are many other facets to an individual's personal well-being, and that many of those things actually will have an impact on their physical and mental health. So when we talk about the major determinants of health, the biggest one by far, the most powerful influence on your health and well-being is your societal and social environment, because that's where you're going to get your basic needs met, right? The things without which nothing else matters. But then, of course, your individual behaviors, your access to medical care, and your personal biology and genetics are all going to be important. And then finally, public health is going to be this approach to the health of an entire population. So on a group basis, what are things that we can do on a meta level, right, on a large scale to improve the health of a group of people? And so when we think about those kind of three main roles, right, that assessment, what are the problems and what's causing them? The policy development, what can we do that we think would be helpful and is feasible? And then the assurance piece, is it actually working? Is it being implemented properly? And is it effective? So that's it for your introduction to public health. Welcome aboard, everyone, and I'll see you in the next video.